Alright, so here we are for part 2 of the TMJ series, and we're going to kick it off starting talking about the muscles of mastication, and in particular here are 4 main ones. You'll notice that one of these is not like the other, and that's the lateral pterygoid. That's going to be responsible for jaw opening, or we call it depression, whereas you notice the other ones here are going to elevate, like the medial pterygoid, and with here masseter elevation and temporalis elevation. So those ones are more prominent. So closing the jaw or elevating the jaw is going to be performed by these ones, but the lateral pterygoid is going to help with that depression aspect. Now, besides the secondary movers, which we went over on the last slide, there are some other tertiary movers which are definitely contributors to those motions, but they're not quite as prominent in that. And so here's just a nice little summary. So you should just be aware that we have all these muscles and what they do, but you can downplay the importance of this for at least our course. We're going to focus on the primary muscles, these ones right here. Now, let's look a little bit into more of the mechanics of the motions involved. We definitely discovered on the last slide it was this curvy linear motion where there's a roll and a slide, or you could say a glide within that. Initially, it is this convex moving on a concave, but what's interesting is as you get to late opening, it actually becomes a convex on a convex. But since that doesn't work so well, you get this sliding moving forward. So you got this disc, and then you got this material right here, that retrodiscal material, which is going to stretch as the disc moves forward, and the capsule is involved in that as well. So you definitely get a capsular lengthening as you have this jaw opening. And I think it's good to imagine the jaw opening in 2 phases, that early opening, the first 20 millimeters or so, and then a late opening, because there's different things that happen during those phases. So let's look at this opening, or referred to as mandibular depression. And so you can see there is that anterior translation that happens more with late phase of depression. So there's an anterior slide, I covered that up a little bit, anterior translation, anterior glide, however you want to pronounce that or define that. This is associated with late phase, and that's going to cause that disc to be compressed here, and then you're going to get that retrodiscal material that's going to be lengthened along with the joint capsule with opening. So if there's a capsulitis, you could see that it would be very difficult to open fully or have full mandibular depression. Okay, so here's another representation of that with the muscles involved. So this is nice. So opening the jaw, we're going to look at that lateral pterygoid and how that's involved in that motion right there. And so you could see that movement that's helping with opening. Now, conversely, with closing, you have the opposite. So the medial pterygoid, masseter, temporalis are all helping to bring that up in that direction. So with closing the mouth, you're going to get a posterior translation of that mandibular condyle. In terms of opening, how far, range of motion total, maybe 40 to 50 millimeters. Generally, we refer to the first 20 as early opening. There's not much translation during that, but then late opening, there's a significant amount. For that reason, though, when you talk about chewing and mastication, you really, depends on what you're eating. If you're eating a big apple or a big hamburger or something like that, you may need 40 to 50 millimeters. But if you think about most of the things that you eat and most of the talking that you do, you can really get away with a very limited amount of opening or mandibular depression. And here's some numbers for that, and obviously gravity is assisting as you open your jaw. So the important thing here is just to distinguish between early and late phase. So I think it's important to know that. Definitely going to be some things that we can measure. How would you measure that? Well, I didn't really mention that here. You can have the patient measure that with the width of their fingers. Generally, we're looking for 2 or 3 fingers in terms of the patient's fingers, not your fingers. Another way you can use to quantify that would be with a ruler. And so this is looking at overall opening. You're looking at the distance from the incisors at the top and the bottom there. Another motion we can look at is this lateral excursion. So we haven't really talked about this too much, but if the jaw were to move laterally, we can measure the distance from the middle incisor at the top here, the middle incisor at the bottom there. Obviously they'd be aligned in neutral, and then how far is that distance between them as they opening, and that's looking at lateral excursion. So we would name this a right lateral excursion because the jaw is moving right away from the midline or the nose versus a left, and we'd look at a left versus a right. And with that, another visualization of elevation here, just some muscles involved again. So posteriorly, translation during closing. So going along with that, another term or things to mention would be this protrusion. Some people call it protraction, and retrusion. And some people call that retraction. So you're going to see those both. So if the lower jaw or lower mandible is going anteriorly, we're going to call that a protrusion. And if this distance right there was 3 millimeters, from the incisor to the incisor there, upper and lower incisors, so with that, we would say there's a 3 millimeter protrusion, and we could look at retrusion as well. The same mechanics involved here with opening, and range opening involves an amount of protrusion, and closing involves retrusion. And it depends on how far the jaw is opened with this. But I guess the takeaway from this slide would be that protrusion is the anterior translation, and then retrusion is the posterior translation. And there's some tension in the temporomandibular ligament with that as well. So here's another visual of the lateral excursion. So with lateral excursion, remember it's that distance that we're looking at there, right versus left. Overall, average numbers, normative values for that, 8 to 11 millimeters. So it's clearly a lot less than opening is. But with that, if you want to think about what happens with that, so if the jaw were to do a right, which is kind of pictured here, so this right lateral excursion, you could see that it's pivoting around that right one, the right TMJ, which means the left TMJ is going to have to basically come out of the joint to a certain extent. We're going to say there's an anterior glide or anterior translation with that. So here's some words. You might want to pause the video at this point and read the words and just think about that. And also maybe go in front of a mirror or just feel your TMJ as you laterally excurse yourself. That kind of sounds funny. As you perform lateral excursion to yourself, to the right and to the left. I'm doing it now. It kind of makes me talk a little different. Yeah, okay. I almost feel like at this point I should introduce some type of cheesy joke. So let me see. Alexa, tell me a cheesy joke. Okay. Okay, so I'm going to repeat that for you. Well, Alexa came up with a classic one. You've heard it all before, but maybe hear it again. What do you call cheese that isn't yours? Nacho cheese. Sorry about that. Okay, so let's go to another visual of the lateral excursion. So if you look at a left lateral excursion of the jaw, so the jaw is obviously going to the left. What are the muscles doing for that? So on the left side, the temporalis and masseter are helping to close the jaw. You can almost kind of see that bottom row coming up in that direction, while the right side is opening. Okay, so you're going to get the right side opening and the left side closing, essentially, if that makes sense. And here's a narrative about that. So left mandibular condyle spins around a vertical axis while within the mandibular fossa, whereas the right mandibular condyle translates anteriorly or slides anteriorly along the articular eminence. Okay, so with mastication and chewing, I think it'll be cool to show you just a visualization of this. So as you look at animals, they're chewing grass or other things, they have to really manipulate that within their mouths. They don't use utensils or other things, and sometimes they take a big wad or whatever that food is, and so they have to go left or right with that. First lateral excursion. Big hit. Yeah, probably never thought kinesiology would be watching animals chew things, but yes. Now when we chew, maybe you want to watch someone chew. Maybe you want to chew and eat some food in front of the mirror. You'll notice that it's primarily that sagittal plane opening and closing, but there is some lateral excursion involved to that. So here you go. Here's just a summary slide. But that temporalis muscle, that's going to be a key muscle. We tend to get a lot of trigger points and spasm within this temporalis muscle. It can be implicated with headaches and can create a lot of referral pain to other places as well. So this temporalis muscle is quite important. And then we know that with children, chronic respiratory allergies and other things, they can develop TMJ joint dysfunction because of the abnormal patterns that they're going through. So this is something to consider, especially in the medical history. If you have someone with very severe allergies or respiratory history, it's something we might need to further explore and to screen the TMJ, make sure the opening and closing is there, and as well with other things. So that's pretty good for this online lecture, and then we'll pick it up in class with some of this material. Thanks.